So these are some hip joint tests for lower back pain. We need to understand the body is 3D, and so we need to test the hip in all three directions. Starting with the rotational plane, we're going to put all the weight onto one foot, in this case the right, and rotate the hands over to the same side. We're going to do the same thing over to the left. Now we're looking out for restriction, so you can't go any further, or pain and discomfort. Both signify some problem in that particular range and that particular plane of motion. Make a note of the difference between right and left. We also need to look at the forward and back planes of motion, the hip extension and flexion. Now be careful with these two motions and make sure that you do stop if there's pain and discomfort. Again, we're placing the weight onto one leg, and this time we're going to be reaching our hands above our head, creating extension at the hip joint. If you can see, I'm not leaning too much into my lower back, but focusing on my hip translating forward. Of course, any pain and discomfort, stop, and if there's restrictions, you can measure that between right side and left side. If the hands above the head are painful, you can always use your hands on your pelvis. Similarly, we're going to look at flexion of the hip, reaching down with the hands. Again, all the weight is onto one leg, and I'm reaching down to see how much flexion I have within my hip joint. Again, test the range, test the restriction, and also, of course, look at pain. If there's discomfort, stop. Make a note of the differences between right and left. The last movement is the frontal plane, the side-to-side shifting motions that we do in our functional daily life. So we're going to look at whether the hip can take the side-to-side motions and also add into that the hands to see if it really can take those side-to-side motions. Again, pain and discomfort, stop at that range, and if you get restricted, that will be your end range as well. Make a note between right and left. We're trying to see here which plane of motion is most affected and make a note of that plane of motion, and then we can design specific exercises to help with that.